But the key word is suspected, not confirmed. So we're working with them closely to communicate back and forth. How are we going to deal with that?
A suspected case of a new virus reported in Reynosa. Local, state, and federal health officials are all monitoring the coronavirus.
Channel 5's Valerie Gonzalez joins us with what's known about this illness.
A case was confirmed in the state of Washington by the CDC yesterday. Today, a Reynosa man is suspected of possibly having the illness. Health officials say there is a common denominator in any coronavirus case suspected or confirmed: travel to the Wuhan province in China. Reporters crowded this morning at the office of the Tamaulipas Health Department. Dr. Gloria Molina Gamboa announced a Reynosa man is under observation suspected of having the novel coronavirus. Somos Noticias spoke to her in a phone call later.
Este paciente viajó a la ciudad de Wuhan en diciembre pasado y regresó el 10 de enero. Tiene 4 familiares en la ciudad de Wuhan. Ninguno está enfermo, ninguno ha presentado síntomas. Él es el único que el día lunes por la tarde-noche presenta síntomas y acude al hospital de Liste a atenderse.
Tamaulipas is not the only one on alert. The CDC was watching the spread of this respiratory illness since it started in China. Yesterday, they confirmed the first U.S. case in Washington state. Hidalgo County Health and Human Services was in a conference call with the CDC yesterday. Chief Administrator Officer Eddie Olivares says they are looking out for any potential new cases of the coronavirus, but says there are 6 other types of this virus.
There's 4 types of coronavirus that are like common colds. They are not dangerous, they're not lethal, they're not harmful. The 2 others that are concerns are SARS, the severe acute respiratory syndrome, and MERS, the Middle Eastern respiratory syndrome.
The novel coronavirus can be lethal, but many patients who had this in China only had a mild illness and were discharged. The symptoms are ordinary.
Fever is number 1 thing they're looking for. Fever, respiratory complication, coughing. Not that much different than a cold or the flu.
If you suspect you have it, Olivares says you ask yourself these 3 questions.
The big thing is, have you been to the Wuhan province in China? Now, have you been in contact with somebody who was there? That's the next question. Any of you were in contact with somebody from there? Were they symptomatic or are you symptomatic? Those are things to ask.
If you think you contracted this virus, you are encouraged to stay home, not make contact with other people, and call your doctor. The Tamaulipas Secretary of Health told us if the Reynosa man tests negative for the virus, they'll know tonight. If it's positive, they may not know until Saturday. In the studio, Valerie Gonzalez, Channel 5 News at 6.